This is Brian Wormers recording a lecture on the case study that was part of cerebral dysfunction. So for this case study, we've got a 3-year-old male that's an X28-week preemie with history of grade 4 IV hemorrhage. He's got a VP shunt, and he's had several revisions to that shunt. So now he presents into the emergency department with a 1-day history of vomiting, being off balance, and having his eyes crossed. What do you think is going on? So the things that I'm seeing here is early with a head bleed, has a history of a VP shunt. He's only 3 years old and he's had numerous revisions of this already. And so now, and he's having increased cranial pressure based on the vomiting, being off balance, and having some eyes that are crossed. So I'm blaming the shunt or something that's causing increased ICP. Diagnostics that I'd anticipate, first and foremost, scanning. So like they'll call it a shunt series. It's a CT that looks at the shunt and looks at the ventricles to see how much fluid is accumulating. And from there, then you can maybe do some medical procedures such as an LP to look and see if there's any bacteria in that CSF fluid. You can actually even measure the pressure as it's coming out to see how much back pressure there would be. And of course, you might get some basic labs. So like CBC, CMP, maybe even coags. So upon discovery, this patient was found to have a VP shunt failure and went right from the OR to right from the ER to the OR. And surgery was deemed successful, and the patient was then subsequently sent into PICU. So what are you going to assess during this time period? And of course, it's vital signs, it's going to be neuros, it's going to be pain. But those are maybe your 3 priorities of this case. So what are some of the assessment findings that would concern you? You know, looking at Cushing's triad and seeing what that does. Also, you know, of course, just vital signs in general, pain, and, you know, all of his neural function. What trends might you look for? Well, you can look for vital signs changes over time. You can look for decreased level of consciousness and other neural changes. So as you get back, this patient was initially having these kind of vital signs. Temp is stable. Pulse is maybe slightly low in a 3-year-old, but 89 is not bad. Respiratory of 20 is fine. Blood pressure of 125 over 46 is high. That could be related to pain, but I would watch this as well. Oxygen sats are 99% with blow-by oxygen being given. His weight is 13.5 kilograms. He is very sleepy and lethargic, but does rouse appropriately. Pupils are equal to and reactive to light and accommodation. His ocular motion is intact. He's got extremity movement times 4. He's got a regular rate of rhythm in his cardiovascular system with sinus rhythm on the monitor. Cap refill is only 2 seconds or less than 2 seconds, and his lung sounds are clear. So this is fairly stable. The only thing that I maybe say is that blood pressure is a little bit high. Could be from pain. It's hard to tell though if he's very sleepy. So things you want to watch for, of course, any of changes to the vital signs, any changes in neuro, and of course pain. So as we look here at this trend, of course we're seeing that the heart rate's going down. We're also seeing the blood pressure is going up. And we're also seeing changes to your respiration rate. So, you know, that's really Cushing's triad, where you're getting bradycardia, you're getting a widened systolic pulse, or widened pulse pressure, so your systolic rate is going up. And then you get respiratory changes. "12 hours post-op, you're seeing similar things. Heart rate's going down even further, respiratory rate's going up, blood pressure's going up. And now the patient starts having a seizure. That's grand mal. Grand mal means all extremities and throughout the whole body. So the actions that you need to take, you know, and hopefully somebody is grabbing you some Ativan from the Pyxis. I would imagine that you would have an IV in this time frame, but if not, you might want to place it. Otherwise, you might want to give some Ativan in a rectal route. Probably not in an oral route if they're having a seizure because you're afraid of aspiration. IM is not commonly used in kids, although it would be something if we had no other choice. So Ativan would be a great choice for that one. During the seizure, patient drops their SATs to 60%, having apnea, so that's right along with that triad. Things that you're going to do, I'm going to call for help. I'm going to have somebody intubate this patient, stabilize that airway, take control of it with a ventilator, and then we will go from there. And hence, the patient was intubated emergently. So you've got an ET tube, and you confirm it. You confirm this with a chest x-ray, as well as using end-tidal, and then you secure it very well, and then you continue on to your assessments. And so things that you're going to perform, of course, you're probably not so much in pain anymore. Your respiratory aspect is controlled, but you're definitely going to do other neuro checks. So what you find is patient's right pupil is 5 and non-reactive, and this is a bad sign. It means that there's lots of intracranial pressure and that that this pupil is not reacting the way it should. So you see these type of things, and hopefully you're calling the intensivist and the neurosurgeon, because these are major red flags. Hopefully you're actually calling them before this point in time, but if now is the time, now is the time. All right, neurosurgery arrives, takes the patient emergently from PICU to the OR for a shunt revision again. Patient is again cared for in PICU and then goes on and has an unremarkable stay. So other considerations for this, so we blame the shunt, but other etiologies that this could have been, he could possibly have had an infection, he could have increased protein, he could have another cause of the hydrocephalus, although the shunt should take care of that. He could have a tumor. He could have, not necessarily that the shunt failed, but it dislodged as he grows up. So those are some of the things that I would maybe think about with this case. But my first and foremost thing would be the VP shunt. All right, that concludes this case study. If you have any further questions, please contact me. I hope that you found this case study as informational, and if you have further questions, please contact me.